Okay, so if you want to introduce Virginia for our final session of the day.
Welcome back, everybody. I hope you are enjoying this as much as I am. It's really been a fantastic day so far. If you missed anything, it will be recorded. It is now my pleasure to talk about a pretty pertinent topic that we are starting to hear a lot more about, and that is Parkinson's. Virginia Stanley is a native of Orange County, Virginia, and after several years of finding it more and more difficult to do the analytical part of his work and to participate in the activities he loved, her husband, Peter, was diagnosed with Parkinson's disease in 1997 at the age of 59. Oh my goodness. With the help of neurologists who understood the disease and attendance at various support groups, they both learned what adjustments were needed to maintain quality of life. Sadly, Peter died in 2012 after a fairly slow progression of the disease. A couple of years later, Virginia was asked to start a Parkinson's support group in Orange, and in doing so, has been able to keep involved with the Parkinson's community, which has been a source of both joy and continuing education. And I just want to go on to say that we learn so much from people who have not just talking the talk, but who have walked the walk. And Virginia has certainly walked the walk. So, Virginia, over to you. Thanks for being with us today.
Thank you so much, Ellen. I wish all these speakers have been so wonderful. I wish I'd heard them all 20 years ago. But I'm so glad that people now can have this exposure. So my husband, Peter, was 59 when he was diagnosed with Parkinson's in 1997. We'd been married for 30 years and had 3 sons who accompanied us on many outdoor adventures, hiking, biking, canoeing, camping, mountain climbing. 2 of the boys were born in Alaska during our 3 years of building a cabin and homesteading there. It never occurred to us that there weren't many more years of adventure ahead. Peter's work was in financial research, and he was very good at it. But for years, he'd also dealt with depression, which at times interfered with his work. He took medications for it, but always found that the best antidote was exercise. So our trips were especially valuable. I think it was about 5 years before he was diagnosed that he began to have trouble doing his work well. He was tired and sometimes couldn't concentrate. We both thought it was more depression, and other medications were prescribed. He was also a talented guitar player and singer, but slowly realized he just couldn't seem to play as he had. He would shuffle, and I remember saying over and over, "Peter, pick up your feet." Finally, one day, his brother-in-law told him he was functioning at about 10% and that he had to go see a good psychiatrist to treat the depression. He did, and immediately was referred to a neurologist in Charlottesville. Dr. Camper told us that as soon as he saw Peter walk into his office, he suspected that he had Parkinson's disease. In his report to our family doctor, which I still have, he wrote that Peter had a shuffling gait, slowness of movement, micrographia, which is small handwriting, low voice volume, decreased arm swinging, limited facial movement, and from talking to both of us about his work, he knew that his intellectual performance had been declining for several years. Reading that now, it stuns me that we never thought there was something other than depression at work. Although Dr. Camper did say that it was sometimes difficult to separate the effects of depression from those of Parkinson's. He also told us that there was no way to conclusively diagnose the disease without an autopsy, which wasn't going to happen, except by taking a medication called Sinemet, a carbidopa levodopa, which is a substitute for dopamine. Parkinson's is a progressive disease caused by the decline of the supply of dopamine, which produced in the brain, which helps the nervous system control muscle activity. The decline usually happens over a number of years before it's recognized as Parkinson's disease. He said if Peter took the Sinemet prescribed and he noticed a difference in his ability to function, then it would more or less confirm the diagnosis. The tremendous difference almost immediately. At his next appointment, Peter took his guitar and played The Wreck of the Old 97 for Dr. Camper, who was amazed. That was pretty exciting, except that it confirmed the diagnosis of Parkinson's. It explained why he was having so much trouble functioning physically, but it did not explain the decline in intellectual performance. His quality of life improved greatly, and so did mine. But I don't remember hearing about a treatment for, or even conversation about dementia with Parkinson's. We began attending monthly Parkinson's support group meetings in Charlottesville and met others in different stages of the disease, and heard speakers talk about various aspects of the disease and research being conducted to find more effective medications and to find a cure. We were told and came to understand that the disease can affect each person in a different way. There's no straight line of prediction for the journey. We found that a medication that was good for one person might not be effective for another. In fact, it might even cause more confusion. It was very valuable to be able to hear both the people with Parkinson's and their caregivers talk about their experiences and how they handled them. It was really helpful when I would meet with just the caregivers and talk about issues that I couldn't necessarily discuss with the whole group together, and was encouraged to do things like take art classes and get help so I could leave for a day. I had a small business which I continued to run, but it gave me work that was just mine, a space of my own, and where I had a little control. And it helped me not be so resentful of the disease and what it was doing to our life together. We found that medications other than Sinemet that was prescribed would often cause confusion and hallucinations. He discontinued them, but there sometimes seemed to be a lingering effect, and he wouldn't completely recover his previous mental level. He continued to drive locally, but one day a very good friend told me he had hit her car as he was turning from a side street onto the main street in Orange. Peter didn't stop, and she only told me because she was concerned about him. He had no recollection of it. It was after that that he agreed to stop driving. I found I could go to work for about 3 hours at a time, and I called to remind him to take his meds. But a couple of times when I got home, I found he just dumped the whole week's worth of pills on the counter and taken a few. I also discovered that if I called and asked him to do a couple of things for me before I got home, such as close the windows because a storm was coming and take something out of the freezer, I'd get home and neither had been done. So a wonderful friend agreed to come and stay with him for a few hours, a couple of days a week, help him get ready for the day, and maybe take him on a drive. That was a tremendous help to me. Somewhere along the way, I heard about Lewy body disease, which sometimes showed up in people with Parkinson's and caused dementia. There were a number of studies being done to test cognitive abilities of those with Parkinson's, and we decided to participate. At one of them, we were each taken into a separate room. I was given a paper with numbers and letters scattered all over it and asked to connect the numbers in numerical order and the letters in alphabetical order. And it was timed. I passed with flying colors. I was then asked to connect the numbers. I was then asked to connect the first number and the first letter and proceed in order, 1A, 2B, 3C, etc. I succeeded there too. When I met back with Peter and his leader, I was shown where he was able to connect the numbers and letters, each in order, but could not connect the combination. It was a huge revelation. He could not multitask. It explained why he could not close the windows and get something out of the freezer at the same time. I've learned since then that executive abilities and visual spatial cognition are affected by dementia, specifically Lewy body disease and Parkinson's. Multitasking is an executive function. The accident with our friend's car, without knowing it, I feel sure was from a problem with his visual spatial perception. At the time, I didn't know anything about Lewy body disease, except like Parkinson's, it could be proven only by an autopsy. Much more seems to be known about it now. Not everybody who has Parkinson's has Lewy body dementia, and not everybody with Lewy body dementia has Parkinson's. Peter happened to have both. He and I knew that people had donated their brains for research, and a cousin of mine had arranged to donate his to BCU's Parkinson's Movement and Disorders Center. We decided to make plans to do that too. But the lines between the physical and the cognitive aspects of the disease were never clear to me. Sleep became a big issue. The meds would often make him tired and want to sleep during the day, and incontinence and need to urinate would get him up a number of times at night. Lack of sleep caused more cognitive problems, and planning a day, for instance, to get a doctor's appointment, required starting early to allow plenty of time to get anywhere. Pushing him to move faster was a recipe for disaster. I soon realized that I needed to simplify my life as much as possible so I didn't feel pulled in different directions. The truth was that I was too tired to try to do anything else anyway. Peter moved more slowly, and there was always danger of his falling. Getting a wheelchair was a huge help. We'd taken some trips by plane, and having a wheelchair waiting for us at each stop made traveling possible. As Sons and I started talking about a nursing home, they were worried about my health and said they really missed not having our grandchildren be able to spend time with us. I told myself I would never do that, but I knew from our years of getting to know others dealing with the disease that some of the spouses died before the person with Parkinson's. And there still was no predicting how any day would go. One of our sons got married about this time at a farm on the Rappahannock River. The ceremony was to take place on the bank across the field from the house. We didn't think Peter would be able to walk safely, so he had a wheelchair, and one of the boys pushed him across. We were all walking back to the house for the reception when Peter rose up out of the wheelchair, took off running across the field along the bank of the river. Everyone's jaw dropped. He made it the whole way, and it just about did him in. But for one shining moment, he scored a victory over the disease. In 2010, he did move into a nursing home in Orange where I could be with him almost every day. It was a big relief to me, and he got good care. I even left for a few days to drive to Canada to visit a cousin. It was nice to take a trip by myself and feel he was in good hands. A couple of years before he moved into the nursing home, he was accepted as a patient in the Parkinson's department of McGuire's VA hospital in Richmond. He'd been in Vietnam, and they were studying the possibility that Agent Orange had caused Parkinson's in some of the soldiers who had served there. The VA's medical team treated every aspect of the disease, so the patients did not need to make appointments with other specialists outside the hospital. Movement and exercise and singing sessions were also provided. A few months before he died, Peter was admitted to the Veterans Nursing Home on the VA campus called Sitter in Barfoot. With our sons all living in Richmond, it meant they could visit him regularly, and I could get there 3 or 4 days a week. And all of his medical team were just steps away. At the advice of the chief nurse, Peggy Roberge, I took some of his lifelong diaries and would read them to him. We both enjoyed that. I always felt guilty for not taking care of Peter at home during that last year and a half. But as I read through the material to prepare for this talk, I realized I could never have given him the care that he got there. He died at Sitter in Barford in February of 2012. Our children had all been there during the day. He was worn out and just stopped eating and drinking. His sister and I were with him. We'd been singing songs and hymns he loved, and I went outside for a few minutes. It was a beautiful, clear night with a full moon. When I came back in, I told him it was the perfect night for the greatest adventure of all. And he just stopped breathing. So the brain autopsy was done, and one of our sons and I met with Dr. Bennett at VCU to go over the report. He pointed out clumps through much of his brain, which he identified as Lewy bodies, and which conclusively confirmed the cause of Peter's dementia. It was helpful to me to have the brain fog in particular explained, and to think that what they found would help some others in the future. There's so many resources, many online thanks to COVID, for those living with Parkinson's now. I've given Ellen Phipps a list of support groups all over the state of Virginia that Susan Dietrich at the American Parkinson's Disease Association compiled, and also the calendar of events for October that she provided, along with it also includes a list of resources for caregivers. There's a list of some of the foundations, the APVA, Michael J. Fox, the Davis Finney Foundation, that offer webinars and podcasts about all aspects of Parkinson's, which you can join for free by Zoom and also access later through their archives. So many activities designed for Parkinson's are available, such as dance classes. We took some and found that when Peter could barely walk, he could dance. And rock steady boxing, big and loud, swimming and yoga and biking classes. So for me, the bottom line is that Parkinson's is a journey over rocky ground, one whose twists and turns cannot be predicted. It's a progressive disease. There's no known cure, and no two journeys seem the same. Those who manage it best, in my experience, both people with Parkinson's and caregivers, are those who continue to exercise, not give up, and to attend a support group to learn and to talk about and share tips for living better. And for caregivers in particular, make time for some things you love to do. Get help when you need it, and you will need it. Try to situate yourself in a safe living environment. Stay in touch with friends, your faith community. Reach out to others and join a support group if you can. There's so many possibilities. I told our sons last week that I was doing this and asked what they remembered about their dad's dementia. They were all in their late 30s and early 40s when he died. One of them told about getting a new truck and driving his dad around in it and talking to him about his first car, a Datsun 280Z, which he'd bought when he was 16 with $75 he'd saved from birthday and Christmas presents. He worked on it for at least a year and was very proud of it when he finally got it roadworthy. His dad looked around the truck and said, "Well, you certainly did a wonderful job." Also, another son who also plays the guitar wrote that Peter had fallen and cut his head open and was taken to the emergency room. And Christopher wrote, "I went to see him in the nursing home late that night after I'd gotten finished playing a gig. We had all gotten pretty used to the fact that he wasn't fully coherent. I was playing an instrumental version of Both Sides Now. It was a sad melody, and I knew that Dad had liked it. Dad was asleep, and I was feeling a bit weepy while playing it. There's a chord change in the song that I never really got the bass line to. As soon as I got through it, Dad opened his eyes and said, 'You're missing the bass line.' I kind of chuckled to myself as I kept playing, and he went back to sleep." And Christopher also wrote, "Even through it all, his natural personality always shone through. Thank God he was naturally a loving and kind person. And he also stayed very smart in certain arenas. He couldn't always tell what car he was in, but he could look in the sky and still recognize constellations and tell stories about them. He would blurt out incredibly intelligent phrases in the middle of what seemed to be a sea of incoherence. I guess what I'm saying is that it may be important to note that even though someone has dementia, it doesn't mean all of them is gone. And I think that's about says it all. Thank you for listening.
Wow. Hard to talk. Virginia, thank you so much for sharing such a beautiful tribute to your husband. He sounds like he was an incredible person, just a wonderful human being. Thank you so much for sharing that. It was so beautifully written and so moving. I'm going to open it up just for a couple of minutes here. We do have a few minutes. We're a bit early, so if anybody has any questions for Virginia, what I really love too, Virginia, that even though you really did have a journey there, ups and downs, but you really are providing a lot of hope for people in terms of the support that can be available to caregivers. And I think that's really key.
But what you all provide today does so much for that, Ellie. I mean, this is incredible what you've done today. And I hope, to maybe the caregivers, the support groups have speakers come, and to have some of you come sometime and speak when you'd have time to do that.
There's some things in the chat. Thank you so much for sharing your story. Amazing testimonial. Thank you for sharing. Any other, again, thank you for sharing, Virginia. What a great lady you are. You are inspiring. That's from Susan. Caroline said, amazing testimonial. Another Carolyn, thank you so much for sharing your story. Again, just to reiterate, Virginia did provide a ton of handouts and resources for folks, and they are available on our website at agingtogether.org. So please don't forget to get those. Steve, I don't know, can we drop those into the chat as well for folks?
What was that?
Just wondering, I know Virginia had a ton of handouts. They're available on the website. But,
okay. Yeah, let me see if I can quickly.
You can drop them into the chat as well. That might be helpful. Carolyn said, so great to know of the resources at the VA. And then Stephen says, thank you, so beautiful. Makes me think of my father a lot. I could just hear that song, Both Sides Now. It's a favorite song of mine, and I could just hear that on the guitar when you were talking about that.
Great. Okay. Yep. Got the conference materials link in there. And
awesome.
You all have done such a great job with putting everything on the Aging Together website. So anything and everything you need is there.
From Nancy, Virginia, that was beautiful. You are an angel. Thank you for sharing. A close family member of mine was just diagnosed. From Mike, Virginia, many people feel guilty about placing their loved ones in a nursing home or an ALF, but you are right that despite your best efforts, you can't always provide the care that they need, and you need to not feel guilty. Yeah. Hard to give ourselves permission sometimes. I experienced that with my own father. I can relate to that.
When I was meeting with Peggy Roberge at the VA hospital, because she would be the person we'd see when we first got in there to make an appointment with Dr. Q. And she talked about the nursing home, and she told me about Sitter and Barford. And I said, well, I'll never do that. And she looked me straight in the eye and she said, Virginia, never say never. And that, you know, I've thought about that a lot, and that's been
Good advice. Well, I do think you hit the nail on the head when, you know, oftentimes there does come a point where a team of healthcare professionals can meet the needs of a person much better than one person who's trying to do it 24/7. And it's hard for us sometimes to recognize that. But you are amazing, Virginia. I know there's probably not a dry eye in the house at this point, but I think it's time for folks to go get some ice cream or some coffee or a soda. We will be back tomorrow morning. Please feel free to visit the exhibits. Steve, can you bring up the exhibits again for us?
Sure.
The
Here we
exhibit
go.
hall. And Virginia, thank you again so much.
You're welcome. Thank you.
All right.
Steve's going to show us the exhibit hall again. We are finishing a little bit early, so some of you can have some time back in your day, but we really do want to support all of our sponsors and exhibitors, and you can find out more information about them by clicking on the boxes or on the links. And we are going to be back here again tomorrow morning at 10 o'clock.
And it should be the same link that you use to get in today. You should be able to get in tomorrow, but many of you have probably received emails from me. I've been sending them out all day. If for some reason you misplaced it, there's a registration form site that can get you into the conference at any point in time. So hopefully it's not that confusing. And if you've got a friend who didn't get in today for some reason, make sure to share that information with them.
And don't forget, we are recording. So if somebody by chance did miss something today, there will be opportunities to hear